The focus of today's hearing, I'll remind us all again, is the role that immigrants play in the healthcare workforce crisis in the United States of America today. And so we're going to begin with our questions. I'll begin with this. One thing we hear often from immigrant healthcare professionals is that they are restricted in where they can practice medicine due to their status. Now, because these professionals are often tied to a specific employer, it is difficult for them to either move within the United States for better opportunities or to serve areas that might be in more need of their expertise or their services, to move to other healthcare facilities in emergencies like the COVID-19 pandemic. Dr. Allure, in your testimony, you mentioned that your non-immigrant status as an H-1B visa holder prevented you from being able to go to places like New York during the height of the pandemic, where there was an extreme shortage of doctors. Can you explain the limitations that come along with your status and how updating our immigration laws would improve the nation's public health?
Chairman Padilla, it's a very important question. When the pandemic took over the country, it did it in waves. New York was literally burning with the pandemic, and Southern Illinois was relatively better protected. We could have stepped up and attended to the call. The governor of New York was asking retired physicians to come back into the workforce, the students to graduate early. We could not do it because it is a violation of our work permit to work anywhere else other than what is specified. Going to the endemic problem of physician shortage, we have services that are not available in an area, and you bring a doctor to one employer. If he's not restricted, he could go to multiple hospitals and help those hospitals during with the shortage. For example, in our neighborhood, when the pandemic hit us, our neighboring hospitals were losing physicians to quarantine. There was a lot of attrition because a lot of senior physicians did not continue to work. And how would it help United States public health? Primary care is a huge area of shortage all across the country. And again, if a physician who has been in that community for years is still restricted to one employer, he's limited. He could probably go 50 miles across his town and do a satellite clinic maybe one day a week. That would help the community there. A lot of physicians in my community who were immigrants, who did their waiver commitments, stayed there, and after they got their green cards, they've opened practices all across. And improving the primary care that way will address the public health. Thank you.
Thank you, Doctor. Ms. Peterson, I know that you're well aware that the U.S. has designated 8,069 health professional shortage areas across the country for primary care. There's a map behind me that illustrates this. This has resulted in 97 million people who live in the United States in an area that has a shortage of primary care providers. In my home state of California alone, there are 643 health professional shortage areas for primary care, affecting over 7 million Californians. Now, I'm sure many of my colleagues here also represent states with significant health care workforce shortages. If you look at the map, consider that every shade of green on this map represents a shortage area. Ms. Peterson, in your testimony, you recognize that these workforce shortages are due in large part to our increasing and aging population, our seniors, our aging healthcare workforce, and the stress imposed on healthcare workers around the country by the COVID-19 pandemic. So drawing on your experiences, can you explain how immigrant physicians have stepped up to fill these gaps in these underserved areas and how they are part of the solution to end our healthcare workforce shortage emergency?
Thank you, Chair Padilla. Annually, over 1,000 international doctors go to underserved areas and fill this need. But just on the members of the committee today, over 2/3 of your state used all of the Conrad J1 waiver numbers last year. And if we gave states the ability to grant these J1 waivers based on their needs, California, all of the other states, Texas, that would permit doctors like Dr. Allure to go to underserved areas and be rewarded and recognized for their work, and to ensure that Americans were receiving the healthcare that they need by opening it up and giving states the ability to really give these waivers. And the Conrad Reauthorization Act does just that.
Thank you. Senator Cornyn.